There are side effects to lash serums that can affect their eyes. And I am a former lash serum user myself. I used 2 different lash serums, I don't know, maybe about 10 years ago, and both of them worked. Both of them gave me great lashes. But the second one also gave me a pretty common side effect to lash serums that we'll be talking about today. So I think one of the questions I get most often from my female patients, and they seem almost embarrassed to ask me about it, is lash serums. I think that they worry, it seems like it's so trivial and I don't really need to talk about it. But in fact, I'm really glad when people are asking me about lash serums because first of all, I need to know what they're on, because there are side effects to lash serums that can affect their eyes. And I am a former lash serum user myself. I used 2 different lash serums not when I was pregnant, but maybe about 10 years ago. I used Latisse because when that first popped up, we were selling it in our office. I was so excited to get really thick, beautiful lashes. And then I also used the Rodan & Field's Lash Boost, and both of them worked. Both of them gave me great lashes. But the second one also gave me a pretty common side effect to lash serums that we'll be talking about today. Welcome to In Focus, the podcast that brings vision, clarity, and expert eye health advice for your entire family. I'm your host, Dr. Rupa Wong, board-certified ophthalmologist, and today we're talking about lash serums. It might not seem as if it is the most serious of topics, but it's one that actually affects so many people because so many people use lash serums. Either they get a prescription for it or they don't even necessarily realize lash serums are in their eye products. They just see on the box that it says, we'll give you healthier lashes. And the reason it can give you healthier, longer lashes because it has a lash serum in it. So I wanted to break it down all today. What are the ingredients in lash serums? Which ones should you avoid? What are the potential side effects? And when you are in the exam room with your eye doctor, what are the questions you should ask them if you are on a lash serum? Because trust me, we actually do want to know. It is not trivial. It is important for us to know that you're taking a lash serum because it really could influence a lot of different things. So there are 3 main types of lash serums. The first one is the one that's really the most rigorously studied. It's the lash serums that have prostaglandins in them. And I'm going to go through what that means, which serums actually have that. The second type of lash serum are the peptide ones. So these peptides help nourish and grow the lashes. Again, not as well studied. And then the third type of lash serum is just ones that have extra other types of ingredients like vitamins and biotin that are said to nourish the hair follicle. So let's get started first with the prostaglandin lash serums because this is the biggest class. And these are the ones that have probably the most popular lash serums that you know about. So the first one of this, so prostaglandin lash serum, it basically came about. The first one is bimatoprost, and that goes by the brand name Latisse. So bimatoprost was actually a glaucoma drop. So when I trained in residency in ophthalmology in the early 2000s, what we and many other ophthalmologists saw was sometimes we would be treating somebody for glaucoma. And I used to work at the Manhattan VA. So we would work at NYU. It would be at Bellevue Hospital, the Manhattan VA, and then a private eye hospital. And the VA, sometimes they only had glaucoma in one eye. So we were only treating with one eye. And the prostaglandin class of glaucoma eye drops were ones that you used at night. It was usually our first line for glaucoma treatment because they were easy and they were nightly and there were relatively few side effects with it. And what some very smart ophthalmologists noticed was, hey, when I'm treating somebody with just one eye, the lashes on that one side got really long. And I noticed that too. A lot of us did. But then this very smart person decided, let's repackage this and make it a lash growth serum. So that is what they did. So they took bimatoprost, which was Lumigan, I believe that was the brand name of the glaucoma drop, and then repackaged it. It's the same thing. They didn't add anything to it. And that became Latisse. I think it was available probably, I don't know, maybe like 2008, 2010, something like that. And that is an FDA approved medication for growing lashes. It has randomized controlled trials on it. So it's the only one that can actually say, of all the lash serums out there, is the only one that can say it grows the lashes because it's been rigorously studied. Now, how does it work? What it does is there's a lash cycle, and it increases the time that the lash spends in the growth phase of the lash cycle, which is called anagen. They don't exactly know why or how, but it does, and it works. So the problem is there are a lot of other lash serums that also contain prostaglandins. And typically they contain a synthetic prostaglandin, and they are sold over the counter, meaning without a prescription. So Latisse, you have to buy it with a prescription. You have to get a prescription for Latisse because it has an FDA-approved medication. These other lash serums that are sold online, they're sold in beauty stores, they don't have an FDA-approved medication in them, but they have a synthetic version. So the Latisse medication is called bimatoprost. These other ones, the synthetic version is called isopropyl cloprestanate. So that's or sometimes you should look for that in your ingredient list. This is what's in Grande Lash. It's what's in Rodan & Field's Lash Boost. It's in a whole host of lash serums that actually do work because they've got the prostaglandin analog in them. And so it's got a very similar compound, but it's not regulated. And this causes problems because while we've looked at the side effects from Latisse, the side effects from some of these that are just at the beauty store or available online or from your friend for purchase have not been as well studied. So that's that first class, the prostaglandin serum type lash serums. They work, but they have considerable side effects. And then there are peptide ones. So there's ones that have myristil, they've got tripeptides. These peptides are thought to be growth hormones for the lashes. They are supposed to strengthen and condition the lashes by stimulating the keratin. That's how these work. The problem is there's no randomized control trial. So a randomized control trial is kind of like our gold standard to see if something works. That's when they, give to populations, they decide, okay, you get the lash serum, you don't. They give the other people placebo and they figure out, does it actually make your lashes grow? There's no studies like that on the peptide growth types of lash serums, but they're in a lot of peptides. If you look, you'll see octapeptides or myristil pentapeptide or a tripeptide. That's what you should look at in the ingredient list. That's what it's trying to do, is stimulate keratin. Not a lot of trials. That means we don't have a lot of data as to their side effects. And then the last group is just kind of these vitamins and biotin and panthenol. A lot of this will just bring in water to make the lashes look thicker. It's the same way that Vaseline works to make your lashes look thicker. Sometimes they can condition your lashes so it prevents them from falling out. And conditioning is not a bad thing at all. But so those are kind of the three different types of classes of lash serums. So how effective are they? So Latisse, which is kind of the gold standard, it's the one that's studied the most. 78% of the users had more than what they called like grade 1 of lengthening of their lashes. Not as much volume necessarily with Latisse, but the lengthening was there. And the maximum effect was at 16 weeks, so about 4 months. So it could take anywhere from 4 to 6 months to see like the full effect. So it's certainly not something that works overnight. None of these lash serums are. And in the initial studies, there was 83 to 93% satisfaction. So it's good. That's why a lot of people liked it. They liked seeing their lashes grow longer. And then for the botanical base and the peptide, like I mentioned, there's really no data. There's no trials, so we don't really know if they're effective or not. Certainly not to the same degree as the prostaglandin lash serums. So let's talk about the side effects. And the side effects for the prostaglandin lash serums have, again, been most studied because it's the serum that's been the most well studied. Some are just really mild, like eye redness. And that's something we used to see in the glaucoma version of the drop too, is redness of the eyes. Some people don't mind it. Some people didn't realize that this was causing their redness. And again, it's not just the Latisse, it's your Lash Boost, it's your Grande Lash. So anything that's got that isopropyl cloprestanate in it can cause redness of the eyes. And I had a friend, she was a doctor. She's like, oh, and she had these beautiful blue eyes. And she texted me a picture and said, oh, my eyes are always red, always red. And we were going through, are your eyes dry? Do they feel this? Do you have allergies? Do they itch? And then I asked her, are you on a lash serum? Oh yeah, I am on Lash Boost. Yes, that can cause redness. You've got to stop the lash boost and the redness will go away. Mild, but it's not worrisome in and of itself. But there are some side effects that are more worrisome. So one of them that's come out now is skin darkening underneath the eyes. That's something that might be reversible. For some people, it's not. That's the side effect I experienced when I was using my Prostaglandin lash serum. Under my eyes got really dark, and that's not something as an Indian person that you want. You already get like baseline dark eyes, and for a lot of people that's something that was unexpected. So that's something to be aware of. Darkening under the eyes. It's also one reason if you're using a prostaglandin lash serum, you might want to put a barrier. You could do like Vaseline or something on the under eye area to prevent absorption of the prostaglandin serum, that lash serum, onto your skin so it doesn't cause it, but it's still possible. Something that's truly devastating and that is not reversible is fat atrophy from the lash serum. So again, they found this with the glaucoma drop first, and now there have been reported cases with not just Latisse, but with these other over-the-counter beauty lash serums that have isopropyl chlorprastinate. And what does orbital fat atrophy means? It means that like your eyes look like they are sunken. Obviously, nobody wants that. And that is going to sometimes then require fillers or surgery to correct it. So if that's a concern, and it's a possibility, it's rare. It's 100% rare. Not 100% rare. That makes no sense. It is rare. It's a rare side effect, but it's possible. And so you have to decide if that is worth the risk for you. Eye color change. And that was a big one that Latisse really got ahead of when they started doing their initial marketing, because we knew that from the glaucoma drops. Now, it's not going to change your blue eyes brown because blue eyes don't have any melanin in them. What it does is darken eyes that already have melanin. So your green and your hazel eyes, or even your light brown eyes, can get darker with a prostaglandin serum lash serum. So you should just be aware of that. And that darkening is typically not reversible. That is to the iris. So that's not something that once you stop, your eye color is going to go back. Again, most people that have hazel eyes or green eyes or even light brown eyes don't want their eye color to change. So that's something to know. It can also really affect the lash line. You can get blockage of the oil glands. Your eyelids can get flipped in. The lashes can be misdirected. These are all things that are side effects, that are known side effects. Not super common, but they happen. So it's something to be aware of, as well as getting fluid in the macula. Now that was found with the glaucoma version of the drop when it was being put in the eye. They haven't really seen that with the lash serum when you're applying it to the base of the lashes, but some of it's going to get into your eye and it can cause what's called cystoid macular edema. Macula is the centermost aspect of your retina. It's what's responsible for your fine central vision. And you can get fluid underneath the retina. It can distort your vision from using a lash serum. Again, this is from the prostaglandin lash serums. So these are side effects that people should be aware of, that when you buy that Grande Lash Mascara from Sephora or Ulta, it's going to make your lashes look great, but it can also do this. Now, the peptides, the biotin, the vitamins, the nourishing agents, very minimal side effects have been reported, and that's likely because these are really just nourishing the lash follicle. They're not actually promoting lash growth. They're not changing the different phases of the lash cycle. So to be honest, they just don't work as well. The other ones, the prostaglandin lash serums, they work well. You will notice my lashes looked amazing. They looked so good, but it comes at a cost. And you just have to decide if that cost is worth it for you. But I want people to be aware that these things can happen. But the nourishing ones, which is what I've switched to, is just one that's got, castor oil and vitamin E and biotin. Does it actually grow the lashes? Probably not, to be honest. No studies have shown that it does. But it will nourish the lashes, especially if you use mascara, things that dry your lashes out. That's never going to be a bad thing to condition and nourish your lashes, and it may help them stick around longer. But very minimal side effects reported with these more natural types of lash serums. So what do you want to look for in a lash serum? Look at the ingredient list. Some of them have a lot. Usually you'll see water and panthenol and various vitamins and peptides. Those are fine, but look for that key ingredient to see if it is actually a prostaglandin lash serum. Look for isopropyl chlorprestinate, look for bimatoprost, look for some version of isopropyl chlorprestinate, because that is going to indicate that there's a prostaglandin analog in there, and that's going to be more associated with this sometimes irreversible side effects, though rare, that can happen. Unless it's a prescription medication, meaning Latisse, you really want to avoid anything that says clinically proven to grow lashes. They cannot make that claim. And what you'll find is they're really tricky about the wording. They'll say, 98% of users experienced more full-looking lashes in a survey or something like that. They'll dance around it, but if they say clinically proven, they can't say that. So I would avoid that if you can buy it without a prescription, because you should not be able to. If you are buying a prostaglandin lash serum, buy it from a reputable source. Don't just buy things online. Buy it from somewhere that you feel comfortable. These things are going at the base of your lashes. They can get into your eye, and there can even just be preservatives. I mean, we're finding out a lot of different preservatives can be really toxic to the epithelium, the top layer of your cornea. They can dry your eyes out. They can cause all sorts of problems. So they're not completely benign. So you want to be mindful of where you buy these things. And then if you experience any redness, any change in your vision, any darkening underneath the eyes, any change in eye color, you obviously want to stop using the serum and then see your eye doctor right away. And please tell us what serums you're on. I know that sometimes there's a tendency when you come in to see your eye doctor, you feel like, oh, they don't need to know my medications. They're just an eye doctor. Or even, they don't need to know this. It's just makeup, right? We need to know it all. Different medicines that you take orally can affect your eyes. Things that you put on and around your eyes can also affect the inside of the eye. So we need to know it all. So if you are on any kind of prostaglandin type serum, lash serum, questions to ask for your eye doctor. Is it safe for me to be on this prostaglandin lash serum? You might have some eye conditions that your doctor would prefer you not to be on a Latisse or a Lash Boost or a Grande Lash. So you need to make sure that it's okay by your eye doctor for you to be on this. Do you see any signs of side effects from being on a prostaglandin lash serum? And I know a lot of people that would use a lash serum and do lash extensions. Again, let us know what you're on and ask your doctor if they see any problems with either of those. And then last, you can just ask them, is there another option if I want lash enhancement without the risk? Most of the other options, the options without the actual chemical ingredients in them of the prostaglandins, they don't work as well. But they work a little bit. So it might be worth investigating and exploring, especially if you just don't want to take the risk. I personally don't want to atrophy. I don't want any kind of sunken eyes. I don't want more darkening under my eyes as much as I loved the way that my lashes were. So I discontinued. Now I just use kind of a more all natural lash serum, but something to certainly discuss with your eye doctor. These lash serums work, but you really should know what's in them and what the potential side effects are before you start using them religiously every single day and have side effects that occur that may or may not be reversible. The all natural lash serums probably are not going to help grow your lashes in the same way, but likely also have very little downside. Though anybody can be allergic to anything. So just because it says all natural does not mean you will not have a side effect or a reaction to it. I think that's also key. There's this tendency to think, oh, if it's all natural, it's fine. Not so. Think about what you're putting in and around your eye. They deserve just as much scrutiny as an eye drop that's being placed in your eye. So that's it for today's episode. If you found it helpful, share it with a friend. If you got another lash serum addict friend and you want them to know about potential side effects, please share the show with them. And if you would like, go ahead and subscribe for more evidence-based eye makeup tips. I like doing these episodes. This month is all about eye makeup and how it affects your eyes. So these are sometimes questions that people, for some reason, feel ashamed to actually ask us in person. So you can just listen to it right here. Until next time, I'm Dr. Rupa. Thanks for joining me. Bye for now. Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.